Good day, I am Winnie Villanueva from the Polytechnic University of the Philippines, and I will be presenting Catastrophic out-of-pocket expenditure on health, evidence for regions in the Philippines. In 2021, the Philippines spent over 1 trillion pesos on current health expenditures, accounting for 6% of the country's growing economy. These healthcare expenditures are mostly sourced from the government schemes and compulsory contributory healthcare financing schemes of the country, with 50.3% of the total. It is followed by out-of-pocket payment of Filipino families, accounting for 41.5%, and the other voluntary healthcare payment schemes available in the country with 8.2%. As we can see here, nearly half of healthcare spending is borne by Filipino families. In the long run, this can potentially influence their economic activities as well as their consumption behaviors. The World Health Organization promotes equitable health financing system capable of providing access to medical and healthcare services as well as protecting each family from financial risk of excessive out-of-pocket healthcare payment given the incidence of different diseases or illnesses. In the Philippines, Universal Healthcare Bill has been enacted, aimed to cater the increasing demand of Filipinos to quality, cost-effective, and affordable healthcare services without compromising financial access, and prioritizing those without financial means. Amid coronavirus pandemic, health policymakers and local executives have been engaged in protecting and promoting people's health and welfare, as well as understanding individuals' healthcare spending patterns. These planners aim to boost health opportunities, strengthen human capital, and improve economic productivity and performance. Nevertheless, these programs and interventions aimed at improving healthcare system must not only address the factors affecting individuals' vulnerability to excessive and impoverishing healthcare payments, but also identify which vulnerable class or group of population requires specialized financial system or immediate improvement. Thus, the specific objectives of this research Thus, the specific objectives of this research are twofold. First, provide critical analysis and estimates of Filipinos' catastrophic out and impoverishing out-of-pocket healthcare expenditure on a regional perspective to measure the effectiveness and progress of Philippines' healthcare financing system in ensuring population protection from excessive and uneven or unequal healthcare costs. Second, this study investigates household characteristics that influence their catastrophic healthcare spending. Using household-based surveys, take advantage of the increasing availability of information. Specifically, it sought to answer the following question. First, what is the current situation of the out-of-pocket healthcare expenditures of Filipino families across the regions in the Philippines? Second, what is the regional incidence and intensity of catastrophic and impoverishing out-of-pocket healthcare payment in the Philippines? Third, what are the significant factors associated with out-of-pocket healthcare expenditures of Filipino families across the regions in the Philippines? For our methods, observations are drawn from the most recent household-based survey in the Philippines, that is the 2018 and 2021 Family Income Expenditure Survey. This is generated by the Philippine Statistics Authority every 3 years, and it is a sample of over 100,000 of households. And that was obtained in 2013 master sample of the agency itself. So this survey represents national and regional data, and it focused only on private households, excluding institutional residents. So the variable we need in this research is first, the out-of-pocket healthcare expenditure. So this is defined as the direct outlay to health practitioners and suppliers for goods and services aimed at improving individuals or populations' health status. In the study, it includes immediate disbursement of Filipino household on medical or healthcare services such as medicinal and pharmaceutical product costs, inpatient facility and consultation charges, and outpatient laboratory and diagnostic tests, but it excludes free or in-kind healthcare services. Another variable needed in the study is the total household consumption expenditure, or the aggregate of all expenses on various goods and services paid in cash, in kind, or received as gift of the households, as well as the value of consumed goods and services produced by the household itself. So this study preferred the use of household consumption over income because it was deemed to be sufficient, or it will provide sufficient indicator of welfare and gives a better or accurate measure. Using income, less accurate result might be generated, assuming households has no alternative resources. So to estimate the incidence and intensity of catastrophic out-of-pocket healthcare expenditures, estimates are grouped into four major regions, that is the National Capital Region, the rest of Luzon region, Visayas region, and Mindanao region. The study followed the metrics proposed by Van Dorselaer and Wagstaff, which is estimating catastrophic out-of-pocket healthcare expenditure based on catastrophic payment headcount, which gives measures of the incidence of these payments, and the overall mean catastrophic gap, which gives measures of the catastrophic healthcare expenditures intensity. So the IET household in the Zayat region faces catastrophic out-of-pocket healthcare expenditures when their out-of-pocket healthcare spending or medical payments as a ratio of total resource available for consumption exceeded the predefined 10% threshold. Similarly, direct healthcare and medical expenditures can lead an impoverishing effect on households when their per capita consumption expenditure after healthcare payments were pushed below the predefined poverty line of 60% of median annual per capita consumption, resulting to a deepening poverty. Both a distribution, the poverty headcount, and the depth or the poverty gap of the impoverishing effect of out-of-pocket healthcare expenditures is the difference between the pre and post-poverty measures. So in modeling the significant variables associated with catastrophic out-of-pocket healthcare expenditures, binary logistic regression is used, and the independent variables employed or considered was household health characteristics such as sex, age, education, and employment, and the household demographic and socio-economic characteristics like household size, their settlement, their socio-economic status, and their access to insurance schemes. Summary of results. So the health spending in the Philippines, it was found out that from 2018 to 2021, private households shelled out 46 pesos for every 100 pesos healthcare expenditure, while voluntary healthcare payment schemes spent only 9 pesos. 44 pesos came from the government and compulsory contributory financing scheme. In nominal terms, the average household out-of-pocket spending on health grew by 10%, that is 5,128 to 5,616 pesos from 2018 to 2021. However, using the 2018 constant prices, the average household out-of-pocket healthcare expenditures falls in 2021 by 5,006 pesos from 5,128 pesos in 2018, representing a 2% decrease. NCR, the rest of Luzon and Visayas region had higher out-of-pocket healthcare expenditures than the national average in 2018 and 2021. Out-of-pocket healthcare expenditures of all the households in the higher quantiles or in the wealthier group in all four major regions fell in terms of real terms or decelerated in nominal terms in 2021, except for households belonging to lowest quantiles or poorest group, which post faster healthcare expenditures for the same period. The share of medicines and health products in total household health spending grew even higher by 5% in 2021, wherein NCR is recorded to be the top spender. Medicines, which includes pharmaceutical products, vaccines, vitamins, and minerals, accounts for a large portion of these expenditures, followed by medical products that includes prevention and protective devices against COVID-19, such as face masks, face shields, and protective gowns. The share of medicines and health products in household total out-of-pocket health spending is even higher than average among poor households and posted an increasing trend from 2018 to 2021. So despite NCR being the top spender on out-of-pocket healthcare expenditure, it was found out that a large percentage of households in the rest of Luzon and Visayas region, which is 3.9% and 3.6% respectively, spent more than above the 10% threshold of their total consumption and their healthcare costs in 2021. This means that households in this region are vulnerable of catastrophic spending. Incidence of catastrophic health spending declined across the regions, with Luzon having the least decline of 3.9% from 4.3% in 2021. The overshoot was observed as the highest in the rest of Luzon and Visayas regions, around 0.1% in 2021 for catastrophic healthcare payment exceeding the predefined threshold. In this table, it also showed that Filipino households incurring catastrophic out-of-pocket on healthcare payments spend an average overshoot of 19.9% of their total spending on healthcare. In particular, families in Mindanao areas accounted for the highest MPG or the mean positive gap among other regions with 10.4% in 2021. It was also found out that in addition to medicines and health products, inpatient healthcare services mostly drives the catastrophic healthcare payments in all regions except in NCR in 2021. Although catastrophic healthcare expenditures decreases, a Filipino household facing catastrophic out-of-pocket healthcare expenditures spent over 56,000 pesos in 2018 to over 68,000 pesos in 2021, representing a 21.6% increase. This was mainly contributed by wealthier families in Visayas region. Using the 60% median annual per capita consumption as poverty line, the percentage of Filipinos that face impoverishment after healthcare payments or spending grew even higher by 0.8% in 2021 from 0.7% in 2018, an increase of 0.5%. Meanwhile, Mindanao regions accounts the highest headcount of Filipinos suffering from impoverishment after healthcare payments. Similarly, the severity of the deepening poverty caused by out-of-pocket healthcare expenditure were visible in the same region with 8.3% and 8.8% for years 2018 and 2021 respectively. The determinants of household catastrophic out-of-pocket healthcare expenditures was found in household head sex, especially in the rest of Luzon area, household head age, because as household head ages, the odds of incurring catastrophic payment also increases. In household head grade completed, in general, educated households are more health conscious and they are more efficient in maintaining health and making better use of healthcare and preventive services. Also, employed household head in NCR, Visayas region, and Mindanao areas were less likely to experience catastrophic spending. Families with members greater than 4 were found to have less risks of experiencing catastrophic healthcare payment rather than those with lesser than 4 members. And household in rural areas, specifically the rest of Luzon and Visayas region, has increased odds of suffering from catastrophic payments by 27.8%. Catastrophic out-of-pocket healthcare payments also increased relatively with socio-economic status, with wealthier families having a higher likelihood of catastrophic payments than of indigent families. And household in NCR, the rest of Luzon and Visayas region, with members reporting paying or having insurance have lower risk of being exposed to catastrophic out-of-pocket healthcare expenditures. So the data suggests that there has not been much progress on financial protection on goals in the Philippines over the last 3 years, at least as measured using catastrophic and impoverishing health expenditure methodologies, nor in reducing the amount of Filipino spending out of pocket on health. The attainment of universal health coverage must be hindered by financial challenges faced by the Philippines health system, that is lack of pharmaceuticals and qualified medical professionals, poor service quality, and inaccessible and insufficient health facilities. This constraint led Filipino households on purchasing pharmaceutical drugs and products at private pharmacies and sought higher quality services and competent medical personnel at private facilities, leading to high and catastrophic out-of-pocket healthcare payments. Thus, the result of this study suggests that reducing reliance on direct healthcare payments and continuous assessment of the implementation implementation of equitable and innovative financing system that reduce financial burden on Filipinos. So systematic monitoring of catastrophic out-of-pocket healthcare expenditure should be maintained to guide health financing policies development and integration, not its control measures. Vulnerable groups should be given focus, especially on Mindanao region, which has the highest intensity of catastrophic healthcare spending and with predominant proportion of households suffering from impoverishment after healthcare payments. Preparedness for the unexpected outbreak must be reassessed as government reallocates programs that provide a social safety net to ensure universal access to healthcare. Benefits may need to be further increased to encourage pro-social health-seeking behavior more generally, especially among the poor, and all Filipinos must know their entitlement to health insurance and are aware of their full range benefits to lessen excessive healthcare payments. That's all. Thank you, Boss.